Assalamu alaikum. Welcome to the channel. Today I would like to talk on a very important question for medical and obstetric doctor, which is contraindications of pregnancy and cardiac conditions. What are the cardiac conditions where pregnancy is contraindicated? If a female have any one of these eight conditions, she must not conceive. 1. Severe mitral stenosis in which the valve area is less than 1 cm square. Severe aortic stenosis in which the valve area is less than 1 cm square. Third, pulmonary artery hypertension due to any cause. The fourth one is Marfan syndrome with dilated aorta more than 45 mm, severe left ventricular dysfunction in which the ejection fraction is less than 30%. 6. Previous peripartum cardiomyopathy with impaired ejection fraction. 7. Aortic dilatation of more than 50 mm in aortic disease associated with bicuspid valve. 8. Severe coarctation of aorta. Thanks for watching.